I believe there are few issues more significant, few issues more impactful to the lives of everyday Americans than the ever-increasing cost of health care and the lack of access to vital treatment.
The United States of America has the most expensive healthcare system in the world. With the ongoing pandemic, it is more important now than ever to understand why our healthcare system is so expensive and to fix it. The United States spending more on healthcare in and of itself is not unusual. A more wealthy country should spend more on health. In fact, there's a clear trend line between a country's GDP and its healthcare spending. But even taking America's wealth into account, the amount we spend on healthcare is much higher than expected. Again, this figure alone doesn't sound alarm if we, in return, experience better health outcomes.
So I know we wring our hands about what percent of the GDP is going to health and all of those kinds of things. But it's hard for me to think of something that's more important than that. So investing in health, I think, is appropriate, so long as you're getting outcomes, so long as you're getting value for that investment.
However, we have poor health outcomes. Americans have the lowest life expectancy of developed nations, the highest chronic disease burden, and the highest rates of avoidable deaths. To understand and address this deficiency, we need to look into the differences between the US's healthcare spending and that of other nations. Breaking up our total spending, we can see that our public expenditures are comparable to other nations, while private spending is far greater. The reason why is plainly because in the US, actual medical treatment and drug prescriptions are just more expensive.
Let's say you get a CAT scan or an MRI, which is something to look at your brain or your spine or something like that. The cost in the United States for that is a lot more. It would probably be over $1,000 to get that kind of X-ray in the U.S. And if you were in another country, it might only be $300. So the prices that we pay in the U.S. are very much higher for the same services.
This reality links to the incredible complexity and fragmentation of our healthcare system. Insurance companies negotiate prices with hospitals, so a patient's bill depends on their insurance company's bargaining power. When the government provides healthcare, like for qualifiers of Medicare or Medicaid, patients enjoy lower bills. Because the government provides insurance for a large group of people, they have a better ability to negotiate lower prices. However, there are many private insurance companies in America which each serve a much smaller number of people than the government. Because they have less bargaining power, patients who have private insurance pay a higher price than patients with Medicare or Medicaid. Lastly, there are the 28.5 million Americans who are uninsured and are most vulnerable to high medical bills because they have no ability to negotiate prices with hospitals. The complexity of this system and the lack of set prices and centralized price regulation allows American medical providers to mark up prices and secure extreme profits. The fact that providers don't disclose their prices beforehand only feeds into their price gouging and makes care more expensive for consumers.
So currently, the negotiations take place between the health insurance and the providers, which possibly would kind of be eliminated if there was transparency that this is the price control. And then the health insurance companies would offer lucrative deals to lure customers to come into their plans.
The single most important thing we may be able to make it possible for consumers to know the price of the healthcare service they're buying.
Government-enforced price transparency can help drive down hospital bills. The American people need the security of knowing what price they will pay for their hospital visit, and most importantly, knowing they can afford it. Our new president and Congress must recognize the dire need to lower the price of healthcare.
We lose as a nation 30,000 people a year unnecessarily because they didn't go to the doctor's office when they should.
Before the pandemic, 51% of Americans said they relied on an alternative treatment or either delayed or deferred medical or dental care because of the cost. Now, these trends continue.
With the pandemic, where people suddenly either lose their jobs and then they can get sick and require very expensive care, uh, sometimes they really hesitate to go to the doctor, or they have to go to an emergency room, where the emergency rooms do have to see people even if they're not insured. But you can imagine there can be a long waiting time there, and sometimes the care that they get is very limited.
With 68% of adults saying that they would weigh out-of-pocket costs as important in their decision to get care if they had symptoms of coronavirus, our cost of care might be making this pandemic more deadly. We can prevent deaths by lowering the price of medical care. Though past presidents have expanded healthcare access and increased transparency, we still have a long way to go. To President Biden and the new Congress, we deeply hope that you take the necessary actions to make American medical care affordable for all.